Welcome to another outreach program. This is Royal Care Counseling Outreach, and of course, I still remain your online counselor. My name is Rachel. So today we are going to be discussing breast cancer. But breast cancer is very large. So for us to extensively talk about breast cancer, for an extensive conversation so that we'll have better knowledge, we'll be well enlightened on this breast cancer, we have to divide it into 3 sections or 2. I'm going to try as much as I can to divide it into 2 sections, but if I can't, please, you're going to pardon me. I'm going to extend it into 3 so that we'll have better understanding of breast cancer. The essence of why I am here is to enlighten us so that we can take precautionary measures to prevent it. And for those of us that already have that cancer, please don't let anxiety take the better part of you. Visit your health worker, and of course always visit your counselor. Positive mindset so that you don't die of depression or anxiety. So as I rightly said, we are going to be talking on breast cancer. So before we talk on breast cancer, let's define cancer. Cancer is a disease caused by an uncontrollable division of abnormal cells in the body. Uncontrollable division of abnormal cells in the body. That is the definition of cancer. So now we are going to be defining breast cancer. Breast cancer is the uncontrollable division of abnormal cells in the breast area of the body. I don't know if I'm making a point. Those uncontrollable division of abnormal cells now form in the breast area of the body. You know, cancer is the uncontrollable division of abnormal cells in part of the body. Now, breast cancer is just the breast axis of the body. So, breast cancer is the second most common cancer in the world. It's common among blacks, but as the word is revolving, it's now existing among the whites. But the whites are able to quickly take control of it than the blacks. Once the blacks see the signs of breast cancer, instead of them to seek medical help, medical attention, they start running helter-skelter, using different types of herbs, going to different kind of prayer houses, taking all sorts of things, instead of you to quickly take precautionary measures so that it doesn't spread around the body. Once it affects only the breast and you don't quickly take precautionary measures, that's seeing your health worker, it spreads around the body, and once it spreads around the body, it's at the end of the day your life is at risk, especially once it affects your lungs, some organs of your body, and your brain. Your life is seriously at risk. So it's still common more among the blacks because they shy away from it. They even find it difficult to talk about it. They prevent or run away from any conversation that has to do with breast cancer. And once you tell them this is the way out, they still shy away from it until it's life-threatening. That's when you see them running and owning up to having breast cancer. Breast cancer starts as a little cancer, like I said, but once it spreads across the body, it becomes life-threatening to the body. Medical practitioners call breast cancer breast CA. So once you hear them saying breast CA here and there, they're talking of breast cancer. In the days of old, breast cancer is common among just the women. They say, okay, breast cancer is just for women now. No. Unfortunately, it's saddening to announce that breast cancer now exists among the male gender. So breast cancer is no longer gender sensitive. It exists both in male and in female. But there are some cases that might look like breast cancer, which some people, number one of such cases is fibroadenoma. That doesn't get bigger, it doesn't spread, it doesn't cause no pain, it just forms around your breast lump. So once you just start feeling things around your breast lump, you say, oh, I have breast cancer. No, sometimes it's not breast cancer, it's fibroadenoma. So that one doesn't cause pain, it doesn't get bigger, it doesn't spread across the body, it's just around your breast lump. That is fibroadenoma. So that fibroadenoma It's accumulated fat around the breast lump. Just fats that are accumulated around the breast lump. That is why it doesn't get bigger. It doesn't get it doesn't have no pain, and it doesn't spread. That's why it's just around the breast axis, around the breast lump, because they are accumulated fat around them. So we are going to talk of number 2, lipoma, or let me say breast lipoma, because lipoma are those accumulated fat under the skin area of your body. That's why we of some part of your body, sorry. That's why I said let's call it breast lipoma, because lipoma, it can affect any part of your body. Those ones are fats that gather around or under the skin of your body, so it can happen in any part of your body. But why I said breast lipoma, because it's that skin or that fatty skin that gathers under your skin at your breast axis. So that's why I call it breast lipoma. And of course, we're going to talk of number 3, which looks like breast cancer. All these I am listing, this number 1, fibroma and lipoma. These are some conditions that look like breast cancer, but they are not breast cancer. They are just conditions that might look closely related to breast cancer. So number 3, we are going to be talking of breast abscess. So breast abscess are the collection, or is the collection of pus around the breast tissues. So once you just feel some pus around your breast tissues, you just assume, oh, I have breast cancer. Please see your doctor to ascertain what is actually wrong with you. Sometimes it's not breast cancer. There are just some conditions that might be closely related or might look like breast cancer. So number 4 of such condition is lymphangioma. So once this lymphangioma affects the lymph node of the body, so once it affects the lymph node of the armpit, people just assume immediately that, okay, since it's affecting my armpit, it's breast cancer. No, go for seek medical help. So once that lymph node affects your armpit axis, it's not always cancer. Please check for breast cancer. Always check your body. I'm going to move ahead to the risk factor of breast cancer. So we have up to 12 common risk factors of breast cancer, but today I think I'm going to take us through 6 of it. So in our next outreach section, we are going to talk about the remaining 6 and some clinical factors and how we can, of course, treat it. But for today, let's go into 6 risk factors of breast cancer. Number 1, age. So breast cancer is common from age 30 to 80, age 30 and above. It's rare, or it's on rare occasion that you see or you hear of breast cancer from age 30 below. But once you are age 30 and above, it poses more risk, or you are vulnerable to breast cancer. That's the age factor of breast cancer. Number 2 is genetic predisposition and family history. Genetic predisposition and family history. If you have an auntie, if your auntie, your mom, your grandmom was once diagnosed of breast cancer, ovarian cancer, cervical cancer, you are prone or you are at risk of having breast cancer. That's it in your family history. So once you notice that any of your sibling, your auntie, your mom, your grandmom has been diagnosed of breast cancer, ovarian cancer, cervical cancer, please, once you are close to 30, please start going for medical checkup, so that once you notice any symptom of cancer, you will be able to get rid of it immediately before it spreads. Cancer is seen as just a little or gradual illness, but once it spreads across the body, that is when it's life-threatening. That is when it begins to threaten your life. So once any close relative of yours has been diagnosed of any of this cancer, please visit your medical practitioner practitioners, occasionally, so that once you start seeing any symptom of it, you quickly take care of it. Let me take you all to the story of Angelina Jolie. Yes, Angelina Jolie. Mom, let me start from her grandmom. Her grandmom was diagnosed of cancer. Her mom was diagnosed of cancer. Her auntie was diagnosed of cancer. She's a white lady. And before she attained the age of 30, she decided that, okay, for her not to have to struggle or fight cancer all her life, she has to take a very quick or rash decision. I'll call it rash because she immediately got rid of her breasts and her ovaries. Why I called it rash is because of course she got rid of her ovaries, so she won't be able to conceive except the intervention of God. And of course she got rid of her breast. That was a very brave step, and now she's living her life well, meaning she's not going to have to go down the history of what her grandmom, her mom and her auntie passed through. She's not going to pass through all those pain and all those cancer treatments. She's not going to have to go down the line with it. She's going to be free. That's why I said the whites quickly get rid of it than the black. Once it's in the black history, once the black notice that, okay, it's a genetic predisposition or it's in their family history, they shy away from it. Instead of going for medical checkup on a regular basis before they attain the age of 30, even after attaining the age of 30, for them to keep checking up on themselves medically, they start running helter-skelter to prayer house. They start avoiding anything medical help. When you see them now serious for medical help, it becomes life-threatening. That's probably it must have spread around their body. That's when they realize, okay, this thing is threatening my life. I'm in serious pain. Let me now go seek medical help. That's what Africans do. Africans shy away from breast cancer, and unfortunately it's the second most common cancer, so it's up deep, it spreads very fast. So once you notice it, you are supposed to immediately take action. Like I said, there are some common characteristics or some occasions or some conditions, that looks like breast cancer. Once you notice even those conditions that I listed, please still see your medical doctor to ascertain that, okay, it's actually the conditions that look like breast cancer. It's not actually breast cancer. Be sure before it spreads around your body. Number 3 is early menarche. That's when you start seeing your menstruation at a very early age, at a very tender age. You are exposed to prolonged estrogen because you started seeing your period very early. Once a girl child starts seeing her menstruation at the age of 9, why she's supposed to see it probably 12, 14, and she starts seeing it at a very early age, she's exposed to estrogen, so she's at risk of having breast cancer. So once you notice your girl child, I'm talking to mothers now, once you notice your girl child starts seeing her menstruation at a very early stage or at a very early age, please teach her to know the essence of medical checkup, so that if such cases occur in future, we are not praying for such. I'm not a prophet of doom. Let me use that. I'm not a prophet of doom, but if such cases start occurring, she'll be able to know the next step to take. But if you shy away from having those kind of conversations with your girl child, when she grows up, she might not know what her family must have passed through, or how, maybe because she started her menstruation on time, there are some factors that she's exposed to, so she should always seek medical attention to prevent breast cancer from occurring, or to prevent breast cancer from spreading to other parts of her body. So we're going to go to number late menopause. It also exposes someone to prolonged estrogen. Once you attain menopause at a very later age, you're expecting that, okay, I'm supposed to be at menopause, and you are still seeing your menstrual cycle, you are still menstruating, you are still at a risk of conceiving. It also exposes you to cancer. So that's the more breast cancer. So that's the more reason why when you notice, okay, I'm not attaining menopause early, I'm supposed to attain menopause early, I am being exposed to prolonged estrogen, I should please always seek medical checkup, medical help, medical attention. You can also seek your counselor's opinion so that your counselor can guide you towards healthy decision making, so that you don't make hasty decision out of anxiety. Number 5, we have non-lipati. Non-lipati. That's, I guess maybe this word was extracted out of non. Non, of course, you all know what non is. People that don't get pregnant, don't give birth. Those are called non. So we have non-lipati. When a woman never gets pregnant, you have just been there, you have never been pregnant all through your life, you have never conceived, you are at risk at having breast cancer. And number 6, some women will come after me. Number 6 is late age of first pregnancy. When you don't get pregnant on time, your first time conceiving, the first time you conceive, and you conceive at a very late age, that can put you at risk of having breast cancer, can be at risk of having breast cancer. So I am going to continue the risk factor in my next video, so stay tuned, and don't forget to subscribe to my YouTube channel so that once I post my next video, you'll be the first to notice it or to watch it. Like I said, there are some conditions that look like breast cancer. You should follow suit. Always go for medical checkup and always see your counselor. Don't forget, this is Royal Care Counseling Outreach, and of course I still remain your online counselor. Bye bye.